This video is here to inform and educate about harm reduction, a compassionate and practical approach to supporting individuals and communities. Please remember, the information shared is not medical advice, and we encourage you to reach out to healthcare professionals if you have specific concerns or need personal guidance. We understand that topics like substance use can be deeply personal and sometimes challenging to listen to, but we hope this video inspires understanding, respect, and meaningful conversations. What does harm reduction mean to you?
Harm reduction is keeping yourself safe while using drugs.
Harm reduction to me means prioritizing safety and meeting people where they are in their journey and giving them the support that they need.
To me, harm reduction is really just about keeping people safe. Instead of saying you have to quit, it's more like, how can we make this safer for you? It's about accepting where people are at and giving them the tools and support they need to reduce the chances of harm.
Or keeping yourself safe in your recovery, whether it be methadone, Suboxone, or other assistance.
I believe that one of the key principles that is most important is the focus on health and safety, especially when it comes to mental health, as well as empowerment through information, which is aimed towards educating and supplying the tools to make informed choices.
Harm reduction intersect with HIV in various ways. And one will look at the overlapping vulnerabilities. People who inject drugs have a higher risk of contracting HIV due to sharing needles. And at the same time, there are also social determinants of health, including stigma, mental health, discrimination, racism, among others, which also increase the risk of HIV, but also increase drug use. And when talk about stigma, many people living with HIV or expressing stigma cannot access health services, and they can't as well access the harm reduction services. So there is a need of integrating harm reduction into HIV or HIV into harm reduction to minimize on this risk.
During my substance use, I learned about the safe supplies and utilize the services that we have in the area. And in my recovery, now I use marijuana for my harm reduction, for my mental health, and to help me stay away from the other substances. Well, because of drug use, I lost custody of one child. I had another child who is the reason for my sobriety today, and my marijuana use for harm reduction has kept my last child out of care, and I still continue to see her today.
What are some of the common misconceptions about harm reduction that you would like to address or correct?
One of the common misconceptions is that harm reduction is just for drug users, which it is completely not. It also applies to mental health, sexual health, and even helmet safety. Another common misconception is that it encourages risky behaviors, which couldn't be furthest from the truth. Harm reduction seeks to reduce the negative impact and consequences for people who are engaging in these behaviors and encourages them to seek the help that they might need.
Stigma around substance abuse has affected me by people saying I'm less than human, that I, should be better off in the ground, or that kind of thing. But I think what harm reduction does is challenge that and put more compassion and humanity and see people as people and not the substance they use. For somebody new to harm reduction or in their recovery, I would say it's very individual and it depends on who you're talking to, but I would say that if you're going somewhere that helps with harm reduction, they're not there to judge you. They're not going to. They're gonna see you where you're at with compassion and help you on your own journey, on your own pace, And that's kind of what harm reduction is about, is going on your own pace towards recovery. You matter, and people want to see you healthy and happy, and that's what harm reduction does.
I think the future of harm reduction is all about making service more integrated, accessible, and tailored to individuals' needs.
We also hope that the future of harm reduction in York Region seeks to focus on increasing accessibility to services, adopting progressive policies like decriminalisation, and addressing health disparities through culturally responsive care.
The integration of technology in mental health support, along with community-led initiatives, will also play key roles. Expanding overdose prevention and safe supply programs, as well as promoting public education to reduce stigma, will also be a central pivoting for how harm reduction will continue to be received in York Region. These approaches will aim to create an inclusive, holistic strategy that treats substance use as a health issue and fosters collaboration with communities for more effective solutions.
PAC, the Peer Advisory Committee, helping to help the community resources in learning about the stigmas about harm reduction and naloxone use, and it's helping me to know that people want to learn about this. It's reassuring that these agencies want to be involved in harm reduction.
This video is brought to you by